This is major. 3 phases of healing. So, that's core to everything. So core, this is right out of the article here. Do you have to be familiar with how detailed this is? No. But should you have a pretty good general understanding of the 3 phases of healing? Yes. This is a graphic representation that explains what happens right here, from the vasoconstriction, vasodilation, inflammation, fibroplasia, macrophages, epithelialization, gives different time frames. So it's well documented. This information is well documented. And of course, this is where it goes in all details relative to the types of tissues involved. But as a chiropractor, especially chiropractors doing personal injury, is it really important to understand the basics of the 3 phases of healing and be able to convey that to a personal injury attorney or a patient or a trial? Yeah, it's real important. So we just dumb it down and say as a bare minimum, you just would want to know that there's the inflammation repair and remodel. And then you'd want to know, typically the goal in the therapeutic goal in the inflammation phase is to decrease pain and inflammation. So the different therapies the chiropractor would use. And then there would be the repair phase. And that's actually when the physiology happens. That's when we're looking at regenerative tissue. And that's when the nerves are going to hyperinnervation, reinnervation. They fire at a lower threshold and they can get tangled in the nerves. So those are all 3 ways that can cause pain along with inflammation. When the patient heals wrong, those are the sources of pain. And so, of course, with physical medicine, we're trying to decrease that, whether we're trying to decrease the nerve sensitivity, help it come back up to normal. Physical medicine does that. And then the alignment of the collagen tissue decreases it from getting trapped. Okay. And then, of course, when we're paying attention to the collagen itself, the formation of the type 3 collagen, then we're affecting the alignment of that collagen, which decreases the likelihood of those nerves getting trapped. And all this makes all the difference in the world. So when would the patient feel it first, second, and third? Well, most of it will start at joint motion and then go into overpressure and active range of motion. And it'll heal in reverse that way. So they'll feel better when they can move 5 or 10 degrees. And then they'll move 10 or 20 or 30 degrees as much as possible. And then sometimes the active range of motion clears back up 100% in all the other non-plane of injury. Sometimes in the plane of injury, it doesn't. Sometimes the last, say, 5 or 10 degrees, it doesn't clear up. And then overpressure in the plane of injury. So you want to pay a lot of attention into the plane of the injury, because almost always, in my experience, the plane of motion overpressure does not clear up 100%. And then when you start looking at the joint motion, you look at the plane of motion and joint motion with x-rays, motion x-rays. Remember, motion x-rays are way more important than neutral because we live dynamic lives. We don't live static lives. So we can look at spinal biomechanics to see how much abnormality there is. This is right out of Panjabian's wide clinical biomechanics of the spine. Well, we're going to pay attention to the motor unit now. Is that motor unit flexing, extending normal or not? Is it translating abnormal? Is it rotating abnormal? Okay. Is it laterally flexing abnormal? We're going to look at these motor units, and then it's very consistent to align them with your other findings. Well, do we have the mechanism of injury? Do we have the plane of motion with the mechanism of injury? We'll probably have some injury magnifiers that help magnify it. If anything, probably the joints are locked out or there's no defensive reaction. And then you'll have subjective. Remember, when you take subjective findings, you not only take them in the static position, you want to take the subjective findings in the dynamic position, and you want to take it in the dynamic position of the plane of motion. So somebody could be a total 0. Symptoms are 0. until they move in the direction of the injury. And then they'll have limiting factors. They won't even be able to go in that full plane of motion. So you've got to be aware of that. You've got to document that. And then you'll have the hybrid findings, anywhere from the foraminal compression to the primary hybrid findings that are very specific, from foraminal compression to Kemp's, because you're involving all three ranges of motion in overpressure, where Sperling's you're not. It's only one plane of motion in overpressure. Same with direct compression or distraction. It's one plane of motion. And then some are kind of more generic, like shoulder depression. That's, it's kind of a catch-all almost. Those are what we'd call secondary findings. So that's a lot of the hybrid. And then you go to the objective, and then you've got the motion studies of altered spinal biomechanics, lesions. And then you'd have the dynaram that would show the abnormal muscle contraction, intrinsic muscle spasms. That's directly related. And it all comes together, explaining all three phases of healing, and then they get to MMI. Well, there gets to be a point where they're not going to heal anymore. And so I say, just if you look at 2 re-exams in the remodel phase or later, you can pretty much expect that person to have permanency from that point forward. That's it. Whatever it is you found, it's going to be permanent. And then you want to make sure you document the ADLs relative to the plane of injury of motion and overpressure. That's where all these, it's called high sensitivity, high relevancy documentation. And you'll have fulfilled every category. You'll have mechanism of injury. Remember, there's 7 major categories the stop low ball offers to support a high value case. The very absolute minimum, you have the mechanism of injury, primary subject of hybrid, and objective finding at least one primary. That took you to MMI, that gave you an impairment rating and the prognosis and need for future care. That's the bare minimum 7 categories. And you've got them all because you did high sensitivity, high relevancy documentation. But knowing the 3 phases of healing becomes real important, especially with personal injury attorneys that try to take the patient out from under care. This is where attorney education becomes very important. They don't realize how they're hurting the case when they take them out from under care in the repair phase. You've got not only they're hurting the potential healing of the patient, but they're hurting the case because now you don't have MMI. You can't give MMI if they're in the repair phase. As soon as you take away MMI and impairment, you just took away 2 of the 4 potential injury awards, the impairment injury award and the prognosis and need for future care injury award. So just like that, the attorney just gutted the injury award and he didn't know it. So it's up to you to be able to explain all this.